When communication breaks down between patients and providers, care suffers.
Error is a part of everyday life and interaction. And in medicine is probably the most important point in time in your life where error becomes a true problem. We look at what really affects our lives and kills people. Well, the number one is heart disease. Number two is a spectrum of cancer. And alarmingly, number three is medical error. GIACOM comes with a unique perspective to how we interact with each other in critical moments. In the medical world, we found out that the way communication's been going has been driving people toward failure, toward error, toward tragedy. And we had a moral imperative to solve that problem.
Many times the big problems can only be solved through new science and technology, which can lead us to answers that we never had before.
CITE is communication and information theory empowered technology. These are very strong, validated sciences that help us understand how meaning is conveyed, messages are understood, and how results are improved when people are involved.
Communication theory encompasses a number of sciences about human interactions. And those sciences include the obvious ones that you're aware of, like psychology, but also brain research that is very new. We can marry the understandings from psychology that we've had with the realities of how the brain's actually working by scanning the brain while we interact with patients to see when important communication actually happens. And what we've discovered is it happens in ways related to our evolutionary biology, not in ways related to our technology. We're starting to get into the secret of where trust lies in the human mind, and Phrazer has become the first product that leverages that understanding.
The software has been developed on Phrazer from ground zero with CITE technology in mind. Every aspect of it that we've put together, whether it be functionality or actually user interfaces, has had CITE in mind the whole time.
Phrazer connects with the patient through many critical pathways. The shape of the handles themselves, that oval shape, subtly mimic a human hand. Phrazer is literally holding your hand throughout the entire process. Vibrating motors located in each handle provide tactile response to the patient's interactions. The color scheme of Phrazer helps draw the eye towards the center of the screen, where your attention needs to be kept. The caregiver provides a familiar face with which the patient can relate to. The graphics transcend words in a way that forms could never hope to match. All of this combines to create a bond of trust between the patient and Phrazer.
I think trust is the catalyst to good care. I think if the patient trusts you and you trust that you've got the right information, the patient gets the appropriate diagnosis, is treated the right way, and is discharged from the hospital sooner.
Phrazer is going to help rebuild that trust bond and then take to the next level the capabilities of medicine for patients.
Phrazer provides a culturally relevant caregiver for that patient who is there only for that patient 100% of the time.
Phrazer removes all bias and takes the information that you give in your language, the language you're most comfortable in, and it takes that and it gives it to your healthcare provider.
With Phrazer, you're able to build trust and communicate with anyone who walks through your door.
In healthcare, the quality process is extremely important. During interviews and diagnosis, any small errors can have drastic effects on patient treatment. This can be avoided by simply gathering the correct information and diagnosis the first time.
We know CITE is valid science, so we know any questions asked using CITE will have more reliable results and more accurate results than asking questions any other way.
When caregivers get correct on biased answers, they can make decisions to get better outcomes. And so Phrazer offers a way to communicate with people in spite of language, literacy, background, in a meaningful way that leverages CITE, that ultimately gets true meaning and gets better results. Given the choice between going into the conventional method where mistakes are guaranteed and working with Phrazer, isn't the answer simple?